Normalizing organ and tissue transplant. Imagine you or a loved one had progressively worsening kidney disease and needed a transplant. In 2014, you would be among the 100,000 people on the list for a kidney transplant in the United States. Your chances for receiving a successful kidney transplant are higher in the United States than in other countries, but more than 4,000 of the people on that list will die waiting. According to the World Health Organization, around a tenth of the world is in need of kidney transplant. This shortage of kidneys has led many to buy kidneys illegally on the black market, with Costa Rica at an epicenter for illegal organ supply. Doctors working at public hospitals earn fairly low salaries, leading them to work at private hospitals for extra money. As paid by the case, the incentive to bring in foreign patients into these hospitals for procedures goes up. Costa Ricans who may be facing economic distress can be convinced to give up a kidney, and thus the black market for organs has thrived. But how do we address this issue? Our CAHI fellow is Cesar Andres Chavez Alfaro, who is a surgeon that works for the Central American Social Security in Alajuela, Costa Rica. He has a master's degree in donation and transplant of organs, tissues, and cells. Dr. Chavez has developed strategy and structure for the Central American network of donation and transplants to improve the opportunity for patients needing organ or tissue transplants, while also demonstrating to health authorities using statistical data the savings represented for the Social Security system when a patient currently on dialysis receives a treatment and opportunity for a better life. As a surgeon, Dr. Chavez noticed the difficulty of safe organ transplants in Costa Rica, as there is no existing system in place. In 1970, kidney transplants were introduced to Costa Rica, followed by heart and liver transplants. These transplants occur under limited legislation and are typically sought out in private hospitals because of the illegal market. There is also no current training or information about organ donations or transplant procedures taught in the medical curriculum. Dr. Chavez traveled to Spain to train in organ transplants and was intrigued with the European system for organ donations. In Europe, there is a network in which organ donations are shared between European Union countries. This means that a person in need of a kidney in France can receive a kidney from a donor in Germany. He wants to bring the concept to Central America by establishing an organ donation network for a larger bank of donations in Costa Rica. By implementing this network in Costa Rica and then bringing it to the rest of Central America, Dr. Chavez's passion has led him to develop a project with the National Coalition Against Illegal Trafficking of Migrants and the Trafficking of People in Central American Healthcare Initiative called the Increase in Organ and Tissue Donations for Transplantation Through Awareness of Good Practices. Through his research and project reports, he wants to develop a web page with resources for doctors to access information about organ donations and transplants. The biggest problem is having people in higher positions like the Ministries of Health and the government to be on board. Costa Rica and other Central American countries host a large Catholic population, including government officials, in which organ donations and transplants are not accepted in the religion. Additionally, this project will be difficult from a financial standpoint. Dr. Chavez wants to make the course free for doctors, nurses, and other healthcare professionals. The private healthcare system and the public would pay a symbolic fee, but the fee amount could cause issues. Dr. Chavez has already had meetings with the various institutions to approve this project. By implementing this model in Central America, other countries can come to Costa Rica and their governments can help pay for the organ donation systems. This would help keep things financially sustainable and ensure that organ donations are done legally without illegal trafficking.
So, how can we, aspiring physicians currently enrolled in the HSI program at Johns Hopkins University, help Dr. Chavez reach his goal? This question was daunting, simply given the importance of organ transplants, as well as knowing the large audience he is trying to reach. First and foremost, we noticed that the language barrier between ourselves and Dr. Chavez was a problem, which means it is likely an issue he experiences when trying to spread the word about his project. So we knew that we wanted to incorporate some sort of translation into our MVP. We thought about creating a database of research articles about organ and tissue transplants that we could translate into Spanish for Dr. Chavez. However, after reading more about his project and getting to speak with him, we realized that Dr. Chavez already had all of this information, so translating research articles for him would not be the best use of our skills. Additionally, we learned that he is more of an outward approach, meaning he is more interested in spreading the word about organ and tissue transplantation to the rest of the world, not vice versa. So how can we aid in this approach? Once we got a chance to speak with Dr. Chavez via video chat, we thought our efforts would be best utilized by translating his entire website that he discussed he was working on. He mentioned that he was working with a web developer who was offering their services for free to create a website that would allow people to learn more about organ and tissue transplants and why his project is important. However, this website has not been created yet, so there isn't content readily available for us to translate. Rather than asking Dr. Chavez to quickly come up with his entire website so we could translate it, which was a lot to ask of him, we asked him to send over some key points that he knows will be included in his website. Although translating that for him is beneficial, we knew that we could still do more. We also noticed that while having this information translated to English would be helpful, it would leave Dr. Chavez and other Spanish speakers out of the loop. How is our English translation going to help if Dr. Chavez is unable to follow along with what we are reading? How can he present this information to a panel of potential funders without knowing what it means? This led us to come up with our MVP, a pamphlet that contains the key points about Dr. Chavez's project in both English and Spanish. In order to lessen any confusion, the pamphlet that we created has the Spanish text side by side with the English text. Creating a standard summary about his project with both languages present is the best way to have a conversation we can all be involved in. Additionally, knowing that Dr. Chavez is interested in modeling his project after the EU, it would be beneficial for him to have these materials in English as well. After coming up with our solution, the first thing we did was reach out to Siobhan, the executive director of CAHI. Since she has worked closely with CAHI fellows and has seen their proposals come to fruition, we figured she would be the ideal person to discuss our solution with. First and foremost, Siobhan agreed that having this pamphlet in both languages will be a huge benefit for Dr. Chavez. She noted that CAHI fellows typically have two audiences, the practitioners of Central America who speak Spanish, and the funders/institutions as well as other potential partners from other parts of the world, which is why having the content in English will be extremely beneficial. She also mentioned that since English is the predominant language used for publishing research results, as well as one of the official languages of the EU and UN, having English content essentially doubles Dr. Chavez's audience. All in all, Siobhan was a key player in helping us come up with our MVP. Once we had started working on our pamphlet, we showed Dr. Chavez what we had at that point, and he loved it. Seeing his excitement about our solution was beyond encouraging, because it was the first time that we realized we were actually making a difference. As mentioned earlier, Dr. Chavez wants to model his project after what is present in the EU. By having the pertinent information regarding his project in both English and Spanish, he will be able to engage in more conversations with even more people of different backgrounds. Moreover, the impact that this opportunity has had on Hannah, Bridget, and myself is difficult to put into words. Not only have we been given the chance to work with someone so passionate about the well-being of others, but we got a glimpse, although small, into what healthcare is like in Costa Rica. Our own passion for healthcare has grown simply from having the opportunity to work with Dr. Chavez as well as with Siobhan.
There are myriad organizations within the US, Canada, and other English-speaking countries with whom it would be greatly beneficial to collaborate for this project. We are hopeful that Dr. Chavez can explore such connections as he proceeds with building his website. Additionally, we have been in contact with Dr. Moshe Levy, who is the Dean of Research at Georgetown Medical School and a renowned expert in the field of nephrology, which focuses on kidneys. Although the semester is coming to a close, our collaboration with Dr. Chavez is not. Over the coming months, we will continue to work on translating materials for his website now that we have successfully created an MVP. As we proceed through our medical educations, we will keep his project in mind and do anything we can to help him build his network. We are so grateful to be a part of this exciting project and look forward to following its progress from dream to reality.